when the screen says that you are now live and from a dull view it becomes bright, we feel so justified that the path of enlightenment, the glory of knowledge, the pursuit towards excellence is becoming brighter and brighter. Especially various milestones we have just come across in the past 3 years for the AOMPT, and now it is the right moment that AOMPT has to actually nurture the parent profession of physical therapy. Although AOMPT is dedicated towards the orthopedic manual physical therapy, we have a commitment towards physical therapy as a whole. And we wanted to envision a betterment of knowledge in neurophysiotherapy, in cardiopulmonary physical therapy, and then we saw that many other professions have techniques and approaches which are giving a parallel perspective to understanding the patient better. But when it comes to treatment, we can make those approaches better and use it as a physical therapist so that patient becomes better, rather than using it as the original profession. Example of such that is cranial osteopathy and the craniosacral therapy. So we interpreted that the philosophical foundations of osteopathy, it's fine, it's good, but when we see that we have to have a functional goal based upon our pathomechanical reasoning, we need to integrate muscle activity, neural into the kinetics and the kinematics of the cranium. So we devised the course Cranial Osteo-Manual Therapy. It's an advanced practitioner clinical certification course of the AOMPT. It is now available as videos with certification, lifetime access videos. Subsequently, of course, we were inspired to do the cranial osteo-manual therapy mainly because we had a extension of neuromanual therapy, the neural mobilization, into cranial nerves. So if we can mobilize peripheral nerves, why not the cranial nerves? And you know that neuromanual therapy, AOMPT is the world's leader. Although the foundation principles are from neural mobilization of David Butler and neurodynamics of Michael Shaikh, both are physical therapists. But AOMPT has improvised that and made it clinically relevant, reality-based application, that is neuromanual therapy, where we can use it on all patients. There is no indications, contraindications. Okay? Every patient with neural symptoms will benefit. That is the goal of neuromanual therapy. And similar lines, that cranial neuromanual therapy course was the driving force for cranial osteomanual therapy. Now if we come across a further development in the knowledge, somatic components physical therapists are treating, and then we identified the missing gap in understanding of the patients, because patients do have visceral problems. Either a poor posture makes the viscera to get dysfunctional, or because there is a viscera dysfunction, the subject develops a muscle imbalance or a postural deviation which leads to a somatic dysfunction. So then we introduced the course Viscerosomatic Manual Therapy. Remember, the word therapy itself is having a big significance. Rather than using it as visceral osteopathy or visceral manipulation, the viscerosomatic and manual therapy, the manual therapy comes under the physical therapy. So legally and professionally, physical therapists, under their domain, the viscerosomatic manual therapy course comes there. And most importantly, when we see that osteopathics, chiropractic, they both are complementary and alternative medicine. We are yet to find a concrete evidence in our Ministry of Health or in the Ministry of Education as per the Government of India whether these two are recognized as medical professions or as allied health professions. So this is a big question mark which I am posing to all those who are promoting an MSc osteopathy course, especially for physiotherapists. See, physical therapist, BPT is a separate course. MSc, any BSc people can do. That's science. This is medicine. You don't want to go back to BSc or MSc. And it comes under the technical domain, the All India Council for Technical Education. Under that, the MSc Osteopathy is there. It's given by the private universities. Apart from that, if I am wrong, please correct me. I want inputs from all the professionals, the senior physios, especially as a healthy discussion and debate. If I am, definitely I am open for it. Please understand that the Maharashtra State Council has clearly given an RTI reply that physios will never administer osteopathy and chiropractic. At the same time, when we are holding another course today and we are launching it, the chiropractic adjustment using activator tool, and that tool, anyone can use the tool. People can have an instruction manual, they can have a map of the human body where the bony prominences are there. Because chiropractic, the working principle is a structural subluxation. Subluxation is articular. Hypermobility, or definitely it has to be. Subluxation comes under hypermobility, instability, then subluxation, then dislocation. That is the pathomechanical continuum. Will we use a kind of an adjustment in a person who is having a subluxation? Okay. So it contradicts the pathomechanical knowledge base. And then you see for how well you can approach such patients. What is their perspective, the chiropractic perspective? Structurally observe the patient, palpate the bony prominences, you find an asymmetry, and then you use the tool to adjust and to correct. Following which you re-examine the pain levels and if possible the lower limb leg length. If you are treating the spine or the sacroiliac or even the lower limbs, you check for the limb length discrepancy, which is also visual observation, not because there is no true shortening. It's not a bony problem. So there's a lot of controversies in evaluation, and I came across this wonderful literature from British Medical Journal which clearly tells osteopathy and chiropractic don't have much differences at all. As we have the smudging of history, David Daniel Palmer, the founder of chiropractic, Andrew Taylor Still, the founder of osteopathy, there is a historical record that both of them met, they discussed, and then this discussion was there before they started the courses of chiropractic and osteopathy. No wonder that these two courses are 80% similar. In one sense, the tools are more used in chiropractic and the spine is more focused in chiropractic. And subluxation is the one which is their actual term, and treatment is adjustment. Whereas in osteopathy, it's not about a structural subluxation, it's about a functional imbalance. Osteopathy also talks about multistructural integrity like tensegrity. And osteopaths, beyond articular techniques, they use various soft tissue techniques like muscle energy techniques, myofascial release, positional release. The positional release is called as the strain counter strain. So osteopaths are wider scope. The thrust manipulation, if you see for chiropractic, they do a direct thrust on the spine. Whereas osteopaths, they do an indirect thrust through the lower limb or through the pelvis for the lumbar spine. So long lever thrust techniques, that is osteopaths. Whereas the direct short lever techniques is for the chiropractors. Of course, the osteopaths have that nature being the healer, and you just initiate or facilitate the healing process through our therapy or our techniques. Whereas chiropractors, they believe that they are the boss. They can easily modify the MRI. I don't mean that they do the Photoshop editing of the MRI, okay? That's apart from the controversies. But they always project the MRI before treatment and MRI after treatment, without even realizing the fact that the sensitivity and the specificity of MRI itself for a disc bulge is very poor. You can't use a diagnosis of disc bulge using an MRI. Normal people will have abnormal MRI, and abnormal painful, severe painful people will have a normal MRI. But still they make that pre-post MRI. And they tell that they have treated MRI because they have not treated the patient. If it is treatment of the patient, they should report the functional improvement, not the pain relief. You talk to the patient for 15 minutes, patients will feel better, the pain will reduce. You ask the patient to close their eyes and do a diaphragmatic breathing for 5 minutes, any pain will reduce. A loving, affectionate touch, a caring touch of a mother, every pain in the body will disappear. It does not mean that relieving pain is a treatment. It is the patient's functional impairment which you target, and the patient becomes better, returns back to function. Not by belief. Yes, of course, belief is an important component in treatment, but you should genuinely explain the mechanisms in terms of why the patient is having a difficulty with the stair climbing, why this patient is having a difficulty with prolonged standing. So can I make that better? Can the patient feel that betterment of quality of life and do the functional activities without symptoms? That is the goal of a physical therapist. A short story. My mom is crying, okay? At my home, my mom is crying. What I do is I go to neighbor's house and my friend's mom is there. So I appreciate her. I am so affectionate with her. I eat the food of my friend's mom. And I am so happy that my friend's mom is so affectionate and she takes care of me so much. And my friend's mom never cries in front of me, because she will cry only in front of my friend, own son. She will not cry in front of me. Only my mom will cry in front of me. Okay. What is it that I am doing? I am not asking my mom, why are you crying? Or what I can do to make you better. I am not asking. And I am going to my neighbor's mom. Same thing we are doing. If you feel that physical therapy profession, there are drawbacks or there are lacunae in knowledge, physical therapy profession is our mother. If she is crying, will you leave her and go to osteopathy and chiropractic? Ask your conscience. Identifying yourself as an osteopath or a chiropractor is like you are mortgaging your self-identity. And then, through that complementary and alternative medicine, you are not going to get recognition of a doctor prefix. I am very strong and I am very sure. If you are not working together with modern medicine practitioners, you will never get the identity of a doctor prefix. So understand that physical therapy profession is from modern medicine. You are not supposed to go back to the roadside traditional bone setters who have proclaimed themselves as osteopaths and chiropractors. This is the history. Globally, everybody knows. I am not underestimating the scope of osteopathy and chiropractic. I am telling the disclaimer. But remember that you are children of physical therapy. It is your responsibility to make the physical therapy profession better. If there is something that is not better means. And to make physical therapy better, you have to learn physical therapy. By learning osteopathy or chiropractic, you can improve your knowledge. Because knowledge is unlimited. Everyone can learn everything. We can learn surgery. We can learn about pharmacological managements. But you can prescribe drugs only if you are allowed to prescribe, like UK. That too basic medicines of the pain-related medications. Surgery, will a physical therapist be allowed to perform? No. But in Australia, a physical therapist performs ultrasound, diagnostic ultrasound. So it is about the law of the government in your country that determines. You can't do injection therapy because someone is giving a training and in bracket it is written UK, Germany, Belgium. So you just learn thinking that the bracket Germany is more important. Never. The present government of India and the Honorable Prime Minister has made it a point that international people, they are putting bracket India as a honor. Make in India, made in India. You learn from India. India is the global leader now. Understand that. Don't put the Belgium, Germany in the bracket or Italy in the bracket and expect that, that's an extraordinary qualification or it's an identity. Never. Physios, I insist that please put India in brackets. Feel proud of your country. Feel responsible towards your profession. And most importantly, do the repair work if you find there is a fault. Your mom is crying. What will you do? You will always console her, find out what is the problem, and then you will listen to your mom. If you don't listen to your mom, you are not fit to be a human being. Of course, you can fight, you can shout at your mom. That's a different issue. I do a lot of it, okay? But you have that inner voice that always tells that what mom is telling is for your good. So remember that. That is what is physical therapy profession is. If you want to get adopted to another person, neighbor, a chiropractic, you want to get a new identity, do the doctor of chiropractic, the full course, or the doctor of osteopathy. Don't think that 2-3 days of osteopathy or chiropractic course will make you a better physical therapist. For being a best physical therapist, you have to be best in physical therapy. We have chiropractic courses, we have experts like Dr. Sunil Bhatt, who has joined on the screen. He has got the formal qualification in chiropractic and is giving the training. When you attend his sessions means you get the knowledge of chiropractic, right? But to practice it, you need to have the thorough fundamentals of physical therapy first, because you are a physical therapist. You can't identify yourself as a chiropractor or osteopath without a doctor of chiropractic or the doctor of osteopathy. Never use the term chiropractic physical therapist, osteopathic physical therapist. Osteopath is a what is called as identity of what is called a doctor of osteopathy or MD in osteopathy. In US and all, MD chiropractic, MD osteopathy, medical chiropractic, medical osteopaths. Non-medical is the what is called as the DO, the doctor of osteopath. So please understand what is in India and then accordingly get your knowledge. But when we use the tool, the activator tool, you want to use it for chiropractic adjustment, do not use as per the chiropractic principles, because that is for that profession. You need to develop. When I say, can an Indian develop a new approach? If Jeffrey Maitland from Australia can develop approach, he is also a human being. James Reax from England can develop a new approach. He is also a human being. Stanley Paris from US, he can develop a new approach. He is also a human being. Indians are not human beings. Why can't Indians develop a new approach? So with that true spirit of the clinical problem solving, multi-structural and functional application of the chiropractic activator tool within the domain of physical therapy is the background behind chiro-manual adjustment using activator therapy. So we are not going to see the leg length. If you see the leg length also, I am going to tell you the tips how to eliminate the errors of the alternative medicine, their philosophy, and also to improvise those approaches and techniques using our pathomechanical principles. When you are observing the leg length, do not jump into a diagnosis without doing the differentiation. Not just the sacroiliac differentiation, lumbar differentiation, femoral length, tibial length differentiations. No. It's only the articular components which they are identifying. But we will have myofascial and neural components, how they can also play a role in the leg length. And the same way, adjustment or the activator tool application, how progressively you can use the tool, how the 6 levels of that force application can be targeted depending upon the movement deficit. You will not see a structural alignment problem and then you are going to use the adjuster tool. You will match it with the movement restriction and then you will do it. And there is no question of subluxation here. It is only question of dysfunction. So dysfunction can be an altered function. So it can be static or dynamic. In either way, you can definitely use the adjuster tool, the activator tool. Thoroughly and thoroughly, the chiro-manual adjustment or the activator tool therapy is fully an indigenous course of the AOMPT. It is got absolutely only one responsibility, that within the physical therapy domain, we can integrate the principles of chiropractic and make it better with our functional pathomechanical competency into a patient-centered multi-structural approach. So that is how the today's course is launched. So today afternoon 4 to 6 p.m. is the course happening on Zoom. And I came here to congratulate, and of course AOMPT is indebted to the support and the inspiration provided by the executive committee members Ritu Sahni, Dr. Darshana Jani, who have not missed any courses of the AOMPT, Dr. Leomil and Dr. Joefin from Philippines, who have been osteopath, chiropractic trained, and they are instructors and they are doing our courses of AOMPT, and they have done almost all the fellowships courses also. They have not missed a single course. And apart from them, many senior core committee members, Dr. Vinoth, Dr. Nitinkumar, if I am missing any, Dr. Sharvani, or when it comes to our senior members in UAE, Dr. Komathi, Dr. Archna in Mumbai, all of them enthusiastically, for one reason, they have enrolled in today's course. It's because it's Professor Senthil Kumar who is teaching. I openly say, I am not a certified chiropractor from anywhere, nor did I do any kind of a doctor of chiropractic course. But what I teach, it's open for 100% money back guarantee. If you are not satisfied with the courses, take your money back. But give it a best try, a worthy try in your life. Courses of AOMPT are not just courses. They are life transforming milestones. So wishing all the participants who are enrolled the very best of luck. Enjoy the session today. And most importantly, be part of this phenomenal success so that you can all use this very simple tool, it's very easy to use. Okay, it's not a big complicated kind of an equipment. Of course, it has its own effect of placebo because of the sound. Definitely, it mimics that cracking sound or the clicking sound of a thrust manipulation. So the patients will be having the placebo. But more important than that is what is your reasoning, what is how you are justified. Can this tool cause harm? Very rare. If you keep it at the high Newton level 6 and then you give the force on a wrong direction, okay, vertebra is right rotated, on the right side transverse process you are not giving, you give it on the left, it will aggravate the right rotation and it might cause a facet capsule injury or a nerve root compression or posterolateral disc bulge, annular bulge can become an extrusion. So definitely understand that there are hazards that are possible because of poor decision making. Otherwise, your presence of mind and empathy for the patient, your self-conscience to keep reflecting upon your own decisions, whether they are strongly based upon pathomechanics, will definitely guide you towards the glory of knowledge by excellence as your destiny. So good luck to you all. Welcome to the CHIROMANUAL adjustment therapy using the activator tool, today's course. The first half will be for the spine and the pelvis, and the second half is for the extremity. Definitely you will enjoy the session and keep inspiring the academy towards more and more milestones in the future. Good luck to you all.